Hello everyone. Welcome to ATP Live Monday. I hope you can see me and you can hear me on Instagram, Facebook, YouTube, whichever platform you're watching from today. Welcome to ACP Live Monday. I am Bimi Salaboide. I'm a pediatrician and I'm here today to answer any questions that you may have about the health of your children in the next 1 hour. This program is brought to you by Ask the Pediatricians Foundation, and on ATP, our goal is to support you to make sure that your children are well and healthy, and we do that through our platforms, online and offline. And so, if you have any questions, you can always ask on our platform, on our Facebook group from Mondays to Saturdays. But today, we just give you a live tester where you can just ask and you can get your answers. So if you have any questions, feel free to drop it as comments on whichever platform you're watching on right now, on Facebook, Instagram, YouTube. Just drop the questions and I'll try and do my best to answer them in the next 1 hour. And please also help me to share the video, share it to any platform where you have the authority and permission to do so. Invite your family and friends, and so that if they have any question about the health of their children, this is an opportunity for them to ask a pediatrician and to get that answer straight away. And so I'm also going to share the same. I'm going to make sure I share the videos to our various platforms. So feel free to do the same. But while I'm doing that, feel free to start dropping your questions. All right, I'm looking for the live video so we can answer them. But I'm just going to share the videos and pin them all to the various platform. Yeah, okay, I've seen it. All right, so thank you so much for joining me. And for those of you who are watching on Facebook, I'm sure you can see my background, and that's it's we're about to do one of our offline projects, and that is our outreach. And this time around, we're doing a project where we're going to go to schools and share to them ATP first aid card reminders. We want all the children, especially our secondary school students, to know about basic first aid care. Like if there's an emergency in school or home where they are, they will know what to do, and we're going to give them those cards to always have with them as reminder on what to do. Often when there's an emergency in Nigeria, we see lots of wrong things being done. We see people pouring water on somebody who fainted or somebody who is having a convulsion, which is very wrong. So people don't know what to do in such instances. People just crowd around people, block all the oxygen that should be getting to the person. So we want to catch them young. We want to start with our children to help them to understand what is the right thing to do, and we're going to give them reminders. We're going to do it first with the schools, and we know that after the schools, they are going to take the message home, and then they're going to pass it on to their parents, and gradually we look forward to reaching every secondary school in Nigeria. So it's not something we're going to do in one day or in 1 year. It's going to be a kind of a long-term project. So we really need a lot of you to support us. So feel free to support us. If you give us like 1,000 naira, that will help us to print about 10 cards for 10 students and distribute 2 calendars to 2 schools. So we really, really need your support. All the details are on my back. And if you are an organization that works with schools and students and you want to partner with us, we will really, really appreciate that. So thank you so much. All right. So I think I've done the sharing now. I'm just going to pin and then I'll start taking your questions and answers. So we're looking forward to partners for our first aid project, first aid care schools project, feel free to send me a message. Feel free to send us a WhatsApp message. Our phone numbers are there on the screen. Feel free to email us on askthepediatricians@gmail.com, uh, or just send us a message on our Facebook group or any of these platforms. We'll be very, very happy um, to partner with you and to support our children. Our vision on Ask the Pediatrician is to make sure that no child dies from preventable causes. And so we're really passionate about this. And so we always look forward to doing things that will support the children and the entire family in the long time, to make sure that our children are healthy and they know what to do in situation of emergencies. All right, I think that's my announcement. Just pinning and pinning all the videos, and then we can start to take the question and answers. Okay, so feel free to drop your questions. Drop your questions. If you have any question about the health of your children, feel free to drop them now, and I'm going to start answering them. Thank you. All right, I think I'm done with all my announcement and sharing, and we can start. But I can't see any questions yet, so yeah. All right. Let me just make sure my videos is okay. All right, so welcome everyone to ATP Live Monday. This program is a program where you can ask any questions that you have about the health of your children, and we're going to answer them in the next 1 hour. So please drop your questions, drop them early so that we will not be running towards the end of the program. Okay, I can see Instagram people outside dropping their questions. I can't see any questions yet on Facebook, but I guess I can see they are watching, so hopefully they'll be able to we'll start getting the questions. So please drop your questions now. Don't delay in dropping your questions. Okay, just 1 minute and then I can start. All right, so let's take the first question. All right, okay, I can do comments. Okay, let's take the first question on Instagram. Hello, Dog Mimi. My son turned 6 months recently, and I've been trying baby cereals and purees. It takes them well. Okay, that's good. But he doesn't like the taste of water. How do I make him take water? I guess. All right, thank you. Very good. I'm happy that I hope you did exclusive breastfeeding for the first 6 months. All right, which is quite good. So you can now, from 6 months, you need to keep breastfeeding, and then you can now also give um, water. There's no rush with the water. As long as you're breastfeeding, your baby is still going to get a lot of water from the breast milk, because breast milk is more or less 70% water. So let baby still drink a lot of breast milk. So don't reduce the amount of breastfeeding. Just keep breastfeeding as you as before, in addition to the purees or the series or all the complementary feeding that you're doing. So in terms of water, what you need to do is to give them a little sips at a time. The goal is not to make them finish like a whole cup of water or a bottle of water at one go. The idea is to let them drink a little bit throughout the day, so you have a little bit of sips of water throughout the day. So you can get them all these sippy cups, or you can just put a little spoon of water in the mouth of the baby. So like after the feeding with the complementary feeds, then you can just let baby take a little bit sip of water. They don't have to drink like a whole cup or bottle of water, if that's what you are trying to do. Even just that one spoon or that sips is enough. Then maybe 1 hour or so later they can take another sip. So that's enough. You should drink water. Sometimes children like when we model things for them, when they realize this is what is being done, and then they can do it. So you can model, as well as also make sure that you let the child drinks a little bit sips of water through the day. They can play with the cup, with the water. It's okay. And in that process, they will get used to it. So there's no rush, but just let them start taking a little sip. And please don't add anything to the water. Don't add any of these flavored drinks that people do. Don't add. It should be plain water that you should give the child, and gradually the child should be able to drink water. It's not a big issue at all. All right. I think that's the question I have. I think that's the only question. I hope those on Facebook can see me, because I can't see any questions dropping on Facebook. All right. And if you need more information on complementary feeding, if you go to our Facebook group, we have a guide section. Many people always ask, where's the guide? Where's the guide section? So if you go to the menu parts of Facebook, either on your phone, on the browser, you will see where they normally list like some subtopics, like they list there. If you click on that menu, guide is one of the menu topics. So if you click on the guides, you will see a drop down. We have several guides, up to 12 or so, if not more. And each of them, so the first one is on breastfeeding, the second one is on complementary feeding, and we have lots of videos on complementary feeding. When do you start? How do you start? What do you give 6 to 12 months, 1 to 2 years, and how often do you give the feeds and all that? All those information, they are there, and I will really, really encourage you that you go through that and watch those videos. We have lots of articles. We also have articles on our website on complementary feeding. We also have a podcast channel, Ask Dr. Bemi ATP podcast, and there's one on feeding your baby for the first 1,000 days. It's also very nice. You can just listen to them, and so that you have all the information first on your fingertips, and then you can go on, because it shouldn't just be series alone. You have to, but of course you're just starting, but as the time goes on, you have to introduce more and more variety to the feed as well. So feel free to check our Facebook group, our website, our podcast, and you can get more information. You can also watch past videos we've had, or even on YouTube or Instagram, on complementary feeding, because once you get it right from the beginning, then it's going to be fine. All right, thank you, Okbeswa. All right, I guess you get the answers. All right, so I'm here. I still don't have many questions. So if you're on Facebook, let me know you can hear me, because I can't see a lot of questions on Facebook right now. So I guess I hope everybody can see and can hear. I hope there's no glitch somewhere. All right, so thank you so much for joining us. Just to remind us that if we have any questions beyond the hour for the ATP Live, you can see always post your questions on our Ask the Pediatricians Facebook groups. We have about 4 groups on Facebook. We have the main Ask the Pediatricians Facebook group, which most of you are familiar with, which is mainly for you to ask children health issues. So and you can ask your questions from Mondays to Saturdays. And the good thing that you will get from our group, different from any other group where you can post questions, is that you're going to get your answers from a pediatrician's perspective. I see a lot of you, especially those on Instagram, tagging us to a lot of other platforms where people are asking questions, and most of these platforms, a mother to mother support platform, so other mothers give other mothers support, which is good. However, sometimes when it comes to health issues, it's not a democracy of opinion. It's not a democracy of how many people say this or how many people say that. So that is a challenge when it comes to health issues. And sometimes people give advice sincerely, but they are wrong, and they kind of further mislead the person who is trying to get a solution. Or sometimes you have so many different answers, and I guess the person asking question is more confused at the end of the day than at the beginning. So the idea of ask the pediatrician is that we want you to get the correct answer from a pediatrician's perspective. I'm not always saying that the pediatricians knows everything, but when it comes to the health issues, we are the ones that you're going to come and meet in the hospitals. We are the authority when it comes to the health issues of children. So we prefer you ask us and get the answers from us. And we don't want people to give you answers that are going to cause more problems. And actually, that is what started Ask the Pediatricians from the beginning. That's actually the main reason why I do this, actually, because I don't want mothers to be confused by fellow mothers who meant well, but sometimes they can mislead you. So feel free to always post your questions from if you want to get a pediatrician's perspective. Okay, I've said all that to take time. Okay, Chami for King, our regular, always here every. I think we should give you something at the end of the year for being the most consistent fan on Instagram on ATP Live Monday. All right, good evening, Doug. Does menstruation change the taste of breast milk? I get these questions all the time, but the answer is no. Okay, your period does not change your breast milk. It doesn't go into your breast milk at all. So it doesn't. All right. When your baby rejects your breast milk whenever I'm on my period, really, I've never experienced that, and I don't. Number one, most mothers who are breastfeeding don't even see their period. That's number one. So, but even if you see your period, your breast milk should not be affected by your period at all. So, what you really need to do is to make sure you're attaching your baby well to the breast. Make sure um, you maintain the hygiene around your hand washing, cleaning the breast, and all that. Otherwise, sometimes I think we as mothers, when you're on your period and all that, you yourself, you may have your own, sensitivity. Sometimes some people have this, their breast could be sensitive when they're having the period, and so it may look as if, maybe you are the one projecting on the baby because you're not really, you may not be at your best because of all the hormones and everything going on around period. But otherwise, your period should not affect your breast milk. So you should keep breastfeeding your baby throughout as much as possible. All right. And there's really nothing to use. Okay, that's not your own question. All right, let's go on to the next question. Saba Luxury Nails. I noticed some kind of rashes on my baby's face, and she's been blowing raspberries for a while. Okay, Saba, when you are asking question, always start with the age of the baby, because everybody calls their children babies, even when they are 18 years old, they are still babies. All right, so we have a large constituency who are not always the same. So a newborn baby is different from an infant, is different from a preschooler, a toddler, different from a school age child, different from an adolescent. So we always like to know the age of the child that you're referring to. That's number one. So I can't really, blowing raspberries is something we expect for babies like 3, 4, 5 months old. Yeah, they should be doing that, and that is normal. Number two, when it comes to rashes, we need to see. So without seeing rashes, we cannot tell you what to use. Okay, I know this is different from maybe what other mothers will tell you. So just tell them, maybe as rash, oh, go and use this. It's a very wrong, very dangerous thing to do. And I'm saying that because I'm not going to tell you anything, because I've not seen the rashes, so I can't tell you what it is and I can't tell you what to use. But I know you can ask other people and they're going to tell you to go use something. And some people use certain products and they wonder why the rashes don't go away after they use those products, as if those products are supposed to be magical, and once you use them, every rash, no matter what it is in the world, should go away. That is not true. There is no cream or product that is magical, that once you use it on any rash, it's going to go away. That's not true. Okay, so don't let people deceive you with their advertisement on media and everything. There's no product like that. So there are rashes that are just, you know, I think I want to use the word like normal, like there's really nothing wrong. For example, newborn babies are born with what we call milia, like a whitish dot on their face. We don't do anything to it, it's going to clear by itself. There's rashes that are due to heat rashes. All you need to do is just let the heat go down and the rashes will go away. Okay, but there are rashes that are due to reaction. Maybe it's just the product you're using, that cream, that powder that you're using on baby skin, and all you need to do is to stop that product, not to do anything else, and the rash will go away. But there are rashes that are due to infections, like germs, in the skin of the baby. And there are different kind of germs. So we have the viruses, we have the bacteria, we have the fungi. You cannot use a product that is meant to treat bacterial skin infection to treat something that is a fungal infection, for example. It's not going to work. And sometimes some products we use can even make some rashes worse. For example, if your child has like a bacterial infection and you go and use a product that has steroids in them, you're going to make the rashes worse. It's not going to get better, And some of us, we even use some of these products in our baby's cream, like regular, which is wrong, which even make things worse for these children. So please don't you ever use any products for any rash without first seeing a doctor, showing them this is a rash. Then we can tell you, oh, this is a rash that you don't need to even do anything, just leave it. Or this is a rash that is due to allergy, stop this thing you're using. Or this is an infection, this is antibiotics, or this is antifungal product that you need to use. So you need to do that first before you can get the appropriate treatment. So I've taken my time to answer that question because one of the most frequently asked questions, rashes and the treatment. And many people are fond of telling you, just go and use this. Even on our Facebook group, some people will quickly rush to answer before the doctors answer, to say, go and use it, which is wrong. And we also have to discourage that. So don't just take anybody's advice. You must make sure that somebody sees the rash. And don't just call somebody who is your friend, who is your family member, who is a doctor, and they just say you go and use this without seeing things. It's also a very dangerous approach. So I hope that has helped. So if you want to post questions, you can, for rashes, I always say post it on our Facebook group, because you can attach a picture, but please don't take picture of your children naked. No private part should be showing in the picture. Take a picture of the child, the area affected, put all the information there. Sometimes we're able to tell you, at least give you an idea, okay, this is what we think and this is what you need to do. But we can't just say, go and use this without seeing the rashes. Okay, I'll go to Facebook. Okay, your baby is 3 months, 1 week. That's okay. Your baby can blow raspberry at 3 months. There's nothing wrong with that. That's normal. All right, Facebook, one question. Finally, is it normal for preemies to be slow in development? Now, this is a very loaded question because your question is so long. So I'll take that one piece at a time. Is it normal for preemies to be slow in development? I would just say no, okay? And I'm saying no, but I need to qualify my answers because I'm answering your question the way you asked the question. Is it normal? It is not normal. For any child, preemies, time babies, to be slow with the development, it's not normal for anyone. All right, okay. Let's pause at that point. But when we are assessing development for preterm babies, we don't use their age based on their date of birth, because which is what most of mothers do. Because most of you just tell us maybe it's 8 months, and when you say 8 months for your preterm babies, you mean 8 months from the time you deliver the baby. Okay, but a pediatrician does not look at a preterm baby with that age when we're looking at their developments and their growth. We usually calculate for preterm babies what we call their corrected age. So the idea of corrected age is the baby was born too early. The baby did not stay all the 9 months in the womb. So if the baby was born 1 month earlier, so when you say, oh, my baby is now 8 months, for us, that baby is actually 7 months old because baby was born earlier by 1 month. So we have to deduct that 1 month and add, remove it so that if the baby has stayed long in the womb to be born at the normal time, then baby would just be 7 months old. And so when we're looking at development for that baby, we will use the 7 months, which is the corrected age, and not the chronological age of 8 months. And so for that baby, we will look at the development and the growth from the corrected age and not their chronological age. And so sometimes when we do that, what you think is slow development just melts away. So there's no slow development. Maybe it's developing at their own normal time, but but not based on the chronological age, but based on the developmental age. That is number one. But number two, preterm babies also have a lot of complications, especially if they are born so early. The shorter the time they stay in the womb, the more the risk of them having developmental problems. The smaller their weight when they are born. So babies born less than 1 kilos, which we call extremely low birth weight babies, they are more prone to developmental disabilities compared to babies that are born like maybe 2 kilos, 2.5. All right. So preterm babies are prone to all these challenges. And because of that, because their brains are so soft, their brains are so fragile, they can easily bleed in their brain. So they can have so many difficulties. And so as a complication of the prematurity, but it's not every preterm baby that will have that issue. It is just those who have those complications. All right, so your baby is 8 months old, but because you've not told us, for example, now, so whenever you're asking questions about your preterm babies, you need to tell us the what we call the gestational age of that baby. In other words, when you delivered the baby, how many weeks was your pregnancy? So that is your gestational age of the baby. So your pregnancy was 28 weeks, your pregnancy was 20 weeks, your pregnancy was 30 weeks. You have to tell us. Anytime you ask questions about preterm babies, you must always tell us the gestational age and the weight, because immediately you tell us that, we quickly know, we calculate the corrected age, and then we can quickly figure out what are the likelihood of this baby having developmental issues. So your baby is 8 months, 2 weeks. You say adjusted. So I don't know what I prefer to do the correction myself. Not because I don't trust you mothers, because you can make mistakes. So it's better you tell me my baby was born so date, and this is the age now, and this is the gestational age when my baby was born, and let me do that calculation myself for the corrected age so that I'm sure. Because if you are sure your baby is 8 months old and your baby is not yet sitting, what do you say? Your baby is rolling. Okay, his arm gets stuck. Another is sitting but can't sit without support. So maybe it's not yet sitting without support. Is moving his bum when sitting and all that. So I see on the group that baby should sit without support from 9 months. So it's not crawling, not walking. Okay. So okay, you told us your baby is 11 months old, but it was born at 30 weeks, birth weight of 1 kilo. Thank you for giving me that information. So if your baby is 11 months old and is 11 months old chronological age and was born at 30 weeks, your baby was born 10 weeks earlier. Yes, so you're correct. Your baby, yeah, your baby is 8 months, 2 weeks. So yeah, your baby should be sitting. Your baby should be definitely be sitting without some support. And so this baby needs to see a pediatrician. Ideally, your baby should have been seeing a pediatrician. I don't know whether you are seeing one already or you were seeing one, and what are the complications your baby has. So usually when preterm babies are born, they tend to stay in because your baby was 1 kilo, so we wouldn't have sent your baby home day one. Your baby must have stayed in the newborn intensive care unit for several days or weeks, and we would have dealt with certain Some babies will not have any difficulties, some babies will have. So your pediatrician that saw that baby knew all the battles they fought, and we know what to expect. So usually we see the babies for follow up. So my question is, have you been seeing your pediatrician for regular follow up? If you have been doing that, then you should see the pediatrician. They should be able to tell you they are happy or they're not happy with the development of the baby. If you have not been seeing them, then you need to see them, and they can do, because there are tests we do. For example, we'll do a brain scan, we'll do all those things as part of our regular check for preterm baby. We check their eyes, we check their hearing, we check all those developments as well. And so I will be worried a little bit about your child's development if your baby is not yet sitting without support at 8 months corrected age. I'm not so worried about the crawling, because crawling can be 9 months for most babies, and some babies don't crawl. I'm not worried about it, but I'm definitely worried about the sitting. So rolling is also 5 to 6 months, and I'm talking the corrected age now. So I'll recommend that you should see a pediatrician. If you have not been following up with one, you need to see one. Your baby was on the dot of the it just a 1 gram, up above the what we call the extremely low birth weight babies. So such babies, we are worried about them, and definitely we need to follow them up. So I really, really, really want you to see your pediatrician so that we can take it up from there. Okay, thank you. All right, I think that is the questions. So for those of us that have preterm babies, some of us immediately we've gone home, like you've taken the baby home. Most of us think, oh, thank God, everything is okay now. Okay. All right. Okay. So yeah, this was okay. You've seen your pediatrician and they say it's fine. Okay, good. If your pediatrician is not worried, then I think maybe you should not be worried. I believe you're seeing a pediatrician obviously, but it's not bad to get a second opinion. All right, so if you want to get a second opinion, definitely feel free to get another pediatrician opinion. um so if they are not worried, then maybe you should just watch. Sometimes some pediatrician wants to give your baby a little bit more time. Let's see how it's going to be. But if you are worried, feel free to get a second opinion from another pediatrician, and then they can advise you further. All right. Okay, I'm happy that you've been going for regular checks, so which is good. So is good that your pediatrician should see your baby, so that's good. So that's fine. It's good that you're going to a teaching hospital, so that's good, because the idea is that if you're in a teaching hospital, they know what to do. So they will money, and they have all the specialists in one place, so they can always give you the right support. Yeah, so that's fine. But when you go back for your next follow-up, please, because you're going to a teaching hospital, and I know that there are different level of doctors in teaching hospitals, and sometimes you may not have seen the consultant. You may be seeing the training doctors, so you can let them know that if it's a training doctor that's seeing your baby, please let them know that you want to have a pediatrician. I mean, the consultant have a look at your baby because you are worried, and they will do that. They will definitely discuss with the more senior doctors, and then they can give you an opinion. Okay, but I'm happy that at least you're in the right place, so they'll know what to do. Great. All right. So if you still have any questions, just on its Facebook, Instagram, drop your questions, and we'll try and answer them. We have gone halfway. We still have an hour or less to take any question. And while I'm waiting for questions, I just wanted to inform you of our ATP School First Aid Care project. Feel free to support us, and I can see you can see our account details, whether in Naira, in dollars. If you are outside Nigeria, you can go through our global giving page. Global giving, we have a page that just write Ask the Pediatrician or ATP, you will get our page, and then you can donate as well on our page, anywhere you are from the world. Thank you so much for your support. All right, I think I have one more question from Facebook. Hello, dog. Please, can a breastfeeding mother take dewormer? I guess you mean something to deworm. I'm not really sure we call it dewormer. Anyway, I'm sure we both understood each other. So, if you talk about taking tablets to deworm yourself, yes, you can. I wonder why mothers always want to deworm themselves, but it's okay if you want to. It doesn't affect your breastfeeding. All right. Should complementary feeding be done at night or just breast milk is fine? I'm not sure I understand that question. So breast complementary feeding should start at 6 months. Okay, and obviously you should be feeding your baby in the daytime, but you give your breast milk. You can, okay. I guess what you meant is, okay, if your child is on both complementary feeding and breastfeeding, it's better to breastfeed more overnight, but let the complementary feeding be during the day so that the child can have time to digest it better before going to sleep. If that's the question, I think it's okay. Not try and let the complementary feeding be during the day and not at night, depending on the age of your baby anyway. Then after cutting a baby's hair, is it necessary to cut it again? That's your decision, really. Some people don't cut their baby's hair, so some do, some don't. We do, there's nothing medical about whether you cut your baby's hair or you plait it or you don't cut it. As long as you're able to maintain it and there are no lice and there are no dandruff, all that, and the baby is not crying when you are combing it, we don't have any problem with that. So there's no law anywhere that you have to cut your baby's hair at all. There's no law. Some people never have cut their baby's hair and their babies are fine. All right. So if babies is 2 years and the baby's lying, what are baby lines? I don't know what that means. What do you mean by baby lines are still showing? So maybe you want to ask that question again. I'm not sure I get the part about baby lines, so feel free to repost and ask. Okay, somebody is saying my 3 months old baby always cry when she's finished sleeping. There's nothing wrong with that. Babies can cry when they sleep. So I guess you need to listen to my last ATP hour program. So last ATP hour I talk about crying babies. I think it's something all mothers need to listen to. And because once you listen to that, you will not ask this question again because babies can cry for every reason. And one of the reasons babies cry is when they want to sleep because they can't tell you I want to sleep. So the only language they have at this age is crying. So they communicate every need by crying. So it's okay. And there's nothing wrong with baby crying. It's perfectly normal for babies to cry. So there's nothing wrong with that. As long as you know, okay, baby crying this time around means they want to sleep, then you just have the baby to get to sleep and that's it. So it's nothing to worry about. Yeah. So you are still trying to say, oh, she cried very well. It's okay. It's okay to cry. It's okay to cry. So if you didn't listen to the ATP Hour last Thursday, I will encourage you to listen to it. You can get it on our Facebook page, YouTube channel, yeah, our Facebook group. Just listen to it because we get a lot of questions about crying babies, and mothers always worry about the babies crying, and sometimes you get them so upset. And I'm always wondering, it's okay for babies to cry. That's that is part of being babies, okay? And there's nothing for you to worry about. There's nothing wrong with that. No, it's not, nothing is happening to them. Nothing, it's not a sign. So in that podcast, I told you the signs to watch out for, the bad crying, the ones that should make you go to the hospital. But a baby crying because they want to go to sleep is fine. There's nothing wrong with that. So it's okay. It's okay. It's completely okay for them to cry. All right, so that's fine. Listen to that podcast. I'm sure you will get. I don't want to do the teaching all over again, but it's available on our Facebook group. Just listen to it. Somebody says, is it normal for them to start putting their hands in their mouth from 3 months? Okay, suburbs, rosary nails. Yeah, it is okay for babies to put their hands in their mouth. So yeah, because babies, everything goes to their mouth. They are the first 2 years of life. We call it oral stage. So babies explore everything by their mouth. So that's why when you give them a toy, they put it in their mouth. You give them anything, it has to go to their mouth, because that is how they explore their environment. So it's a normal phase of development for babies. So there's nothing wrong with that. So that's why usually at this age you give them things like something they can hold in their hands. You see that most of the time they put it in their mouth. So when you give them toys, make sure they are soft toys that even if they bite on it and all that, it's not going to cause them any harm. So that's perfectly normal. Okay, Florence Adefolajo, that's one of our matrons. Good evening, ma'am. A 9-year-old with frequent sore throat, blocked nose, no fever. What could be responsible and should it be managed? Frequent sore throats. I would want to see that child. I think it's best the child should be seen and the throat should be examined first. We need to know what is inside that throat that is causing frequent sore throats. So we definitely need to see the child for initial examination. Um, blocked nostrils and all that. So some children could have what we call allergic rhinitis, and they tend to have all these recurrent, what look like respiratory tract infections. So what you need, usually the ENT doctors tend to see them. The most important thing is to know triggers and avoid if possible. And so it's best to see a doctor first, probably a pediatrician or even ENT doctors will do, so that they can examine the throat. Also, some children will have enlarged tonsils, but usually for a 9-year-old, I don't expect them to still be dealing with that unless it's been there for longer than they've been dealing with it before they turn 9. Usually for the under 5, we worry below 6 years old, we worry about tonsils, adenoids, and stuff like that. But 9 years old, we expect that to have dealt with itself if it was there. So I recommend that they should see a pediatrician or an ENT doctor. The commonest thing I would think of is something that has to do with allergic rhinitis because of the blocked nose and the throat, so they go together. So if it is recurrent, that's what I would think about. But it's best to have a proper evaluation first so that we're sure what is going on with the throat. Okay, thank you. All right. Okay, I think that's okay. I don't have any other question on his Facebook. I thought I have one. All right. Okay, so I can just talk a little bit more. Okay, okay. You're asking on behalf of the mom. I hope the mom is listening. Yeah, I hope so too. But if not, you can let her know what to do. She can just see a pediatrician. Let them just examine the throat first. Sometimes we may examine the throat and we instantaneously know what is there. Sometimes there's something in the throat. But if it is a nose getting blocked more recurrently at 9 years old, then I will worry about allergic rhinitis. Most time there's nothing we're going to do about it, but we can avoid triggers, or they can give some nasal sprays as well for when there are, because it's just like somebody who's having an asthma attack. It's just that this time around it's in the nose, so we have some sprays as well that they can use to deal with it when they are having very bad episodes. Otherwise, most of the time they will be fine. All right. Somebody say my baby is always bringing out speed. How old is your baby? I guess your baby is 4 months old. I hope, because you just said 4 months, 7 kilos. So we don't know whether your baby is currently 4 months old or or that was the last space you have. All right, but there's nothing wrong with babies bringing out space. Babies bring out their saliva. It's perfectly fine for them to do that. We only worry if it's too much, like you are soaking bibs. I mean, most of us, we know when something is too much, like you change the bib almost every hour or something like that, then yeah, that would be too much. But most babies will bring out a little bit of spit anyway, because they can't always swallow. The reason why yourself and myself we are not drooling is because we are swallowing our saliva. So you are producing a lot of saliva, but you are swallowing it back. So, but babies, they don't swallow as fast as they produce. So a little bit of it will still come out. And when they are bringing out teeth as well, they may do it more. Some don't, but some can. And that does not mean you need to start buying or giving anything, because I'm very alert and cautious when people start asking if something is about teething, because the next question is, oh, sure, I should go and give teething powder or teething mixture. Please don't give anything. So teething is a perfectly normal developmental milestones for children. The same way they see, the same way they get their neck control, the same way they bring out their teeth. There's nothing to be done in a child who is teething beyond leaving the child alone. So don't give any so-called teething mixture. And it's okay for baby to bring out saliva. Use the bib, clean it, and that's it. You don't need to do anything more than that, and you don't need to worry. Sometimes the babies tend to bite. They can bite you, or they bite on the nipple and all that. What you do, you can get them teethers, soft toys, something that they can bite on, but make sure you wash and sterilize it frequently, because it tends to drop a lot. So you just wash, sterilize it, and you can bite on that, but don't give any so-called teething mixture. You can even put it in the fridge, and that's it, so that when you put it in their mouth, it's kind of cools the gums. And some babies like that as well. And once the teeth are out, all those feelings go away. But please don't and don't give so-called teething mixture. I beg you. All right. I was told that after cutting babies, if it grows, babies. Oh no, don't listen to all those myths. All those myths. You need to listen to my podcast or broadcast on myths. So your baby's hair, cutting it, not cutting it, blah blah blah. There's nothing medical about it. Trust me, there's absolutely nothing medical about it. It's your decision. So we have religions that they scrape the baby's hair from day one. Okay. And I know people who have never cut the baby's hair from the day they were born till now. So there's absolutely, I didn't cut my baby's hair until she went to secondary school, and it's a requirement for them to cut their hair. I never cut her hair, and she was okay. So there's absolutely nothing to worry about her. So I know most of us grew up with all these myths and beliefs and all those stories. It's absolutely nothing will happen to your baby. So if you want to cut your baby's hair, it's fine. If you don't want to cut it, it's fine. So it is your decision what to do with your baby's hair. It has absolutely no medical implication. Nothing will happen to your baby, whatever you do, either way. All right, Mary is saying, my baby is a year and 6 months old. She still babbles and struggle to say one syllable word. What do you advise? I'm definitely worried about an 18 months old who is not saying any word. I'm definitely going to be worried. So a 18-month-old should be combining words together, should be saying short phrases like mommy car, mommy biscuit, those kind of things. So if your baby is not even saying any word at all and is only babbling, you definitely need to see a speech therapist. Okay, so please see a speech therapist. The first thing we normally do is to check the hearing. So I know some of you will be so sure that your child can hear. I know that that's not the problem, but it is one of the things for us as professionals to rule out. Any child who is not talking, we must confirm beyond reasonable doubt that child can hear. So we have to do a hearing test. Ideally, we should do it routinely for all children, but in Nigeria, it's not a routine. In some countries, we screen all the babies for hearing at birth, and then when they are going into school, when they are starting school, maybe age 4 or something, we also do another hearing test for them. So it's routine to do a hearing test. We don't just rely on, the child can hear. So you must get a hearing test done first by an audiologist. Audiologists are the professionals who do hearing tests, and we have some of them in Nigeria as well. If you're in Lagos, the military hospitals, you can get your hearing test done there. So most of the ENC departments also do hearing tests. So we need to get that here. Once we are sure the child can hear, then the next thing is speech therapy. And then if there are other developmental issues, the speech therapist may want you to see a developmental pediatrician or pediatric neurologist. But if there are no other issues beyond the talking, the child is otherwise fine, then the speech therapy can give you some advice on how to help your child's language development. Okay, but it's very important because children's brain in the first 5 years of life are still developing. And so, whenever we pick up a problem, we want to solve it quickly and we want to solve it early. And early intervention helps because the brain is still developing. It's better to deal with things as soon as we pick it up. We don't need to have a diagnosis, we don't need to know the cause, but we need to deal with it. So, that is the approach for this age group. All right. So, please see a audiologist to have a hearing test done and then see a speech therapist. That's my advice. All right. Okay. I think I've answered the question about the hearing, the haircuts, and all that. That's it. All right. Okay. We're almost done. We don't have any. Today's a slow day. We don't have a lot of questions today. It's okay. Some days are like that. But just in another 5-6 minutes, I'll be half line of the hair rather. So, but if you have any questions, remember that you can post your questions on Hacks the Pediatrician's Facebook group. For your children health issues, you can post it from Mondays to Saturdays, okay? But Sundays you can post your questions. And then if you have adult health issue, we have ATP Family. And if you have first-time mothers, we have FTM Facebook group. And then we have the ATP Still a Mom for those who need like emotional support following the loss of a pregnancy or babies. We are there too. We have other mothers who have gone through it who will also support you along with our peer, our trained peer support first aiders. They are also there for you. So feel free, don't go through the journey alone. We are there to support you. Okay, Florence, okay, you say as we can tongue tie cause speech delay. Okay, this is a question we get all the time, and a lot of mothers also believe that whenever their children are not talking, the first thing they look out for is tongue tie. The short answer is that tongue tie does not cause speech delay. It does not. It does not. Yeah, I know a lot of people will be delivered by that answer alone. Tongue tie does not cause speech delay. Most of the things that people call tongue tie, there's actually no tongue tie. It's just the frenulum that they are saying. That's number one. Number two, okay, occasionally we actually don't have really very serious tongue tie. So, but that will not delay the talking. It may affect the clarity of the word you're saying, but not the talking itself. So that's the only thing that tongue tie will do. If it's really bad, then they may talk, but some words may not be clear. But that is even for very serious bad tongue tie. But most so-called tongue tie that many people are running after and cutting, they don't. So I actually wrote an article on Much Ado about tongue tie because it's so rampant. I mean, in some private hospitals, they routinely do what they call tongue-tie surgery for all the children. So they just go snipping 15,000. I know that's a very easy way to make cool money in Nigeria. So, and I always tell mothers, please, there's no need to cut any tongue-tie. Just leave the baby's tongue alone. It doesn't cause speech delay. Most of them don't need any problem. Sometimes in that process of doing the so-called tongue tie surgery, some people actually now cause the proper tongue tie because the healing of that cut is actually now with fibrosis, and that actually do convert that tongue to a proper tongue tie instead of if you have left the frenulum alone. So please leave the baby's tongue. If the child is not talking, it is not tongue tie. It is not. Okay, there are many other reasons why children will not talk on time, but it's not tongue tie. If a child has a very bad tongue tie, the speech may not be clear, but they will say talk. All right, so tongue tie does not cause speech delay. All right, okay, I have two more questions and I will answer them before my time is up. So, Ire Peter Diana, what causes anemia in babies? So, anemia is a medical jargon for low blood level or shortage of blood, and there are different type of anemia. Okay, the commonest one is what we call iron deficiency anemia. So when the iron level is low, because that red blood cells that we have, it has something inside we call hemoglobin, and it requires iron. So that hemoglobin consists of iron and some protein together. So if the iron is low, then the production of the red blood cells will be low, and the person will have what we call iron deficiency anemia, and that's the commonest one. And it comes from not eating food that are rich in iron, or babies, if the mother lost a lot of blood during delivery, or so many issues, but usually from food, nutritional deficiency, and tends to cause iron deficiency anemia. But that's not the only anemia. We also have what we call folic acid deficiency anemia. So children who are not taking fruits and vegetables, they can have folic acid deficiency, and that can also cause anemia. Vitamin B12 as well, if it is low, it can also cause anemia. So those are the anemias due to deficiency of nutrients. We also have anemias that are due to genetic conditions. So babies are born with conditions and that can predispose them to anemia. So sickle cell anemia is the commonest one in our environment. So children who have SS gene, they have what we call sickle cell anemia, they will be anemic, and they don't need iron. So loading them with iron, their blood level won't go up because it's something genetic. It's the way the red blood cells are formed. It tends to be what we call sickle shaped, and it tends to break down quickly, hemolysis, and so that's another cause. Sometimes people can have anemia from losing blood. You can lose blood either by having an accident, injuries, or some children have clotting problems and they can lose blood. Any little clot, they bleed so much. Or there are some conditions like GCPD. If you have GCPD, if you're exposed to a trigger factor, your blood cells will be broken down so quickly, and that person can have anemia. And you can also have anemia from serious illnesses. There are medical conditions, we call them chronic anemias. If you have those kind of conditions, then you can have low shortage of blood. But those are the most common causes. There are other fewer causes that are rarer, but those are the common ones. So if you think the baby is short of blood, please don't just go and buy blood tonic. All right, go to the hospital. We can do a blood test. Yes, there are blood tests we would do. When we do the blood test, we will tell you straight away, this is iron deficiency anemia, this is folic acid deficiency anemia. Sometimes we may need to do other blood tests, like we may need to do your genotype and all that. But there's a way doctors will examine your child, listen to you. Even before doing the blood test, they have an idea the kind of anemia it to be. So, for example, if I say a child with sickle cell anemia, there's a way they look, there's a way their hands are swollen, they have crisis. So, when I see those ones, I just need to confirm their genotype to know it's sickle cell anemia. So, there are other conditions as well. So, don't do it by yourself. Most doctors will know how to diagnose anemia and the cause of anemia and the treatment. So it's very easy to treat anemia. If it's iron deficiency, we just give the child iron, so blood tonic, and there's a dose to give children. Children can overdose on iron, and most parents will just go and buy the normal blood tonic you take, and you give children. You start giving them 5 minutes, 2.5. You may kill the child with iron poisoning. So don't do that. There's a way the pediatricians have to calculate the amount of iron, and there are different kind of formulation for children that we give them. So please don't do self-management. See a doctor, a pediatrician, so that they can manage it properly. And if your child has sickle cell anemia, for example, they don't take iron. We don't give them iron. We don't give them blood tonic. So they take folic acid, and we have other things that we can do to support them. So it is the job of the doctor to make the diagnosis of anemia, the cause of the anemia, and that will determine the appropriate intervention for the anemia. So I hope that is helpful. Okay, let's go back to Facebook. Somebody said, can a 6 month to be introduced to complementary feeding the day the child clocks 6 months? Yes, the answer is yes. The day the baby clocks 6 months, you can start complementary feeding. I would just encourage you to go to our Facebook group, watch all those complementary feeding videos, know what is complementary feeding, know how to go about I noticed a lot of Nigerian mothers don't know what complementary feeding is. Most people just think complementary feeding means you start giving your baby pap or cereals. It is, there's nothing further from the truth. There's more to complementary feeding than just giving pap or cereal from the stores. There are so many factors we need to, and I find that when mothers know what to do, they know what they are trying to do, it's a bliss, doing complementary feeding. So I always encourage everybody to watch all those videos made by Global Health Media videos, and we have them on our Facebook group, we have them on our page, we have it on YouTube. You can Google it. They have an app which I've talked about several times, Babies Birth and Beyond app, which you can download, and you can watch these videos in Yoruba, you can watch them in Hausa, you can watch them in English, in French, in multiple languages. So we have all this information for us. I think one thing mothers of this generation we cannot complain about is lack of information. Information is everywhere, so please get hold of them. All right, and it's normal for a baby learning to crawl, to go backwards. There's nothing wrong with that as well. The next question: my 3 months old baby always uses her gum to hold my nipple when sucking. My mom says she's sitting. I think I've just answered a question about sitting. I hope you were here when I did. Please do not give any teething mixture at all. Just keep breastfeeding your baby. It's not okay to get it, so don't get any teething powder. And mothers, okay, I'll say that last. Let me just answer the next question, because if I go off, I may not come back. Okay, the last question say, thank you for answering. Maybe how many sucking you hear the sounds of the catarrh, it's not coming out. So as far as the pediatrician is concerned, when a child has catarrh, something is coming out from the nose. That's the meaning of catarrh. Any other thing else is not catarrh. So if your child doesn't have any nasal discharge or mucus or something in the nostril, blocking the nostril or coming out of the nose, the child does not have catarrh. It's not every sound that you hear that means anything, because I get lots of questions about, oh, there's catarrh in the throat or and it's not coming out. That is not catarrh, okay? So if there's catarrh, something must come out from the nose. That is the definition of catarrh as far as the pediatrician is concerned. So just leave the baby alone. If your baby is making any sound that you don't understand what it means, then we have to hear the sound, or we have to see the baby so that we can, because there are sounds that is normal. There's what we call sucking sound, there's swallowing sound, there are sounds that babies make. Is when the milk is flowing down the food pathway and going to the tummy, it's perfectly normal for you to hear the sound, and that is normal. And usually the baby is fine, baby is comfortable, baby is not in any distress. I think the sound that worries us is if a child is sucking, or and the child is struggling to breathe, or the child is so uncomfortable. That is what will worry a pediatrician. That is when you need to come see us. But a child who is otherwise okay, smiling, happy, sucking, sleeping fine, not struggling to breathe, not having any issues, just stop worrying about them. Just let the baby be. But like I said, when you go for immunization, that's an opportunity for you to ask us or show us, and then we can always tell you what to do, so you don't have to worry. All right, okay, now when I'm ready to go, everybody is asking more questions. All right, okay, let's just take this last one. Is screen time good for babies less than a year old? The answer is no. There's no screen time for babies. No, zero, no screen time for babies. We don't want babies to watch TV or anything. We want babies to play with their mothers and family members, not to watch TV. Okay, and does baby walker have any bad effects on babies? Yes. No baby walkers. I'm sure you already know the answer to all these questions. This is what you ask. No baby walkers, please. But it's okay to ask and get your doubts clarified. So baby walkers are the most dangerous piece of equipment you can have in your baby in your nursery or at your house. In fact, countries like Canada actually banned it, and I know pediatricians in US and many places we've said no to it. I guess maybe some of those countries are not strong enough against the manufacturers. So it's a very dangerous piece of equipment. Babies can fall from it. Number one, it doesn't make babies to walk. It's a misnomer. Babies don't work with baby workers, right? So that's the physiotherapists have said no, you don't. Your babies do not need any instrument to walk. They don't need any baby walker, and because when babies are moving with baby walker, the baby is actually not walking. Baby have no control over it, and they can easily, fall, and it can cause serious injuries. So it is something we don't want you to have. Just throw it away if you have one, or take it back to where you bought it from. Let your baby just be on the plain floor, crawl around, cruise around the table or wherever. When they're ready to walk, they walk. They don't need to be in any baby walker. So it's a very dangerous equipment, not recommended by any of the professionals, doctors, physiotherapists. All of us said no to baby workers. All right, thank you, Mrs. Adefolaju. Said it has been a very informative and educative section. You're welcome, ma'am. All right, so thank you so much, everyone, for listening. I think there was something I was going to say, but I forgot. Maybe I'll say it another time. But just to say that on Thursday, we'll take another episode of ATP Hour, and I'll be talking about another important topic that has to do with the health of our children. Please support ATP. We're doing our ATP outreach in October. Our details are on the screen. Anywhere you're watching from, please support us, and we will be able to do what we do to our children in the schools. We want to empower them with first aid information, knowledge, and reminder kits and stuff. If you have any questions still, feel free to post it on our Facebook group, and we will answer them. Some of you are late. It's already 7 p.m. Unfortunately, I have to leave right now. So feel free to post your questions if they've not been answered to our Facebook group, and we will answer them. Give us at least 40 to 72 hours. We'll try and answer your question. If anything's an emergency, please go and meet us in the hospital. Don't post it on the Facebook group. But anything that's an emergency, hospital, if it can wait, yes, leave it on the Facebook group. If you cannot wait, please go to the hospital. So I'll see you again next week by grace of God, where we'll have another episode of ATP Live Monday. Till then, have a wonderful, wonderful evening. And hopefully I'll see some of you again on Thursday for ATP Hour. Bye. Bye-bye.